You're watching UNICEF television.
The Navy rescue team guides a boatload of people to safety after their homes were flooded in Mozambique's Gaza province. Their rescue is bittersweet. Grateful for being brought to shore with their most precious possessions, they know that there are those who could not be saved.
I don't feel good about leaving because some people died there.
Intense rains and flooding of the Limpopo River has affected over 250,000 people in Mozambique. In Chokwe, one of the hardest hit districts, all business is brought to a standstill and social services shut down.
Quando o governo decretou o alerta vermelho,
when the government declared the red alert, the government and the Emergency Response Center communicated immediately to the communities to leave the city immediately.
imediatamente as populações para se retirarem imediatamente da cidade.
With many people having lost their livelihoods, emergency workers, the United Nations and NGOs are working tirelessly to provide basic food, water, shelter, healthcare and sanitation facilities.
The most immediate needs we see is basically shelter, because we have managed already to move food and non-food items, and everybody has received rations and have minimum packages of food and non-food items. However, the shelter still is arriving, it's already on the move, but it may be a problem because the people still cannot go back to their houses.
As part of its emergency support in the crisis, UNICEF has deployed assessment teams in the most affected areas and is working with partners at the camp by providing supplies such as high nutrition biscuits, bed nets, tents and family kits containing basic and household items for child-headed households and other vulnerable families.
These families lost everything, even basic equipment like this, like household items. Say it's an emergency kit for these families to survive on for a couple of weeks.
16-year-old Salatiel ran to the camp after hearing the evacuation call. He's arrived with nothing but the clothes he had on. He's not sure where his family is.
I have tried to call my aunt and the phone is dead, and so I didn't know where my family is.
The contents of the kit will at least provide him with the basics he needs while at the camp. After that, he must face the reality of what has happened to his family and his home. As more displaced people seek refuge at the camp, the risks of disease and abuse increase.
We are working in collaboration with the Ministry of Interior and with the sort of camp administration to deal with the issues related to prevention of gender-based violence and violence against children, etc. Cholera prevention, mainly with the Ministry of Health and with the Ministry of Public Works, which of course has a crucial role in the provision of safe water, and schools, clearly with the Ministry of Education.
To help prevent the spread of disease and provide life-saving information, UNICEF is supporting a mobile unit at the camp.
In situation of an emergency like the one we live in here in Ciccaletane, it's very important that families, children, mothers are aware of the need of preventing any situation of cholera by being aware through key messages on sanitation, on how to wash their hands. So hand washing is very important. The use of latrines is also crucial.
As more areas become affected by floods and intense rain, rescue and relief efforts continue as more Mozambicans are forced from their homes. This is Suzanne Bierkes reporting for UNICEF Television. For more information, go to unicef.org.
You've been watching UNICEF Television.